Caring for a loved one at home can be both rewarding and overwhelming, but with the right tips and tools, you can make it safer, easier, and more effective. In this guide, we'll share essential home nursing hacks every family should know. From organizing a care station and managing medications to preventing infections, avoiding caregiver burnout, and using smart technology. Whether you're supporting an aging parent, recovering patient, or someone with a chronic illness, these practical insights will empower you to provide compassionate, efficient care right at home. Today we will talk about home nursing hacks every family should know. So before we start, make sure to hit the like button and subscribe to my channel. Understanding the basics. Set up your space like a mini clinic. One of the most crucial steps in effective home nursing is setting up a dedicated care zone within the home. This doesn't mean transforming your living room into a hospital, but organizing a space where medical care can be efficiently delivered. Invest in a bedside table with drawers or a rolling cart to keep essential items like gloves, hand sanitizers, gauze, medical tape, digital thermometers, blood pressure cuffs, oximeters, and medications organized and within arm's reach. Label all drawers and containers clearly to prevent confusion during an emergency. Use a pill organizer to prepare medications weekly, avoiding last-minute dosage errors. Maintain a logbook or binder with critical documents, such as medication lists, doctor's contact information, health records, and appointment summaries. Digital copies stored on a phone or tablet ensure instant access when needed. Hygiene hacks. Maintain sterility and prevent infections. Hygiene is the foundation of safe home nursing. Regular hand washing and the use of medical-grade gloves before and after patient contact should be mandatory, especially when changing dressings, cleaning wounds, or handling bodily fluids. Keep alcohol wipes and sanitizing sprays in multiple rooms. For bedridden patients, invest in no-rinse cleansing foams and disposable bed baths. Use waterproof bed pads to prevent mattress contamination and change them regularly. Rotate the patient frequently, at least every 2 hours, to prevent pressure ulcers, bed sores. Using cushions or inflatable pads to relieve pressure on vulnerable areas. Learn the correct method for cleaning and dressing wounds. Avoid cotton balls, which can leave fibers behind, and use sterile saline and gauze instead. Keep nail clippers and grooming supplies clean and separate from others in the household. Feeding and nutrition hacks, meal prep, hydration, and special diets. Nutrition plays a critical role in recovery and overall well-being. If your loved one requires a special diet, low sodium, diabetic-friendly, or liquid-only, it's best to meal prep weekly. Label food containers with date, contents, and dietary specifications. Use a blender or food processor to prepare soft foods for those with chewing difficulties. Monitor fluid intake using graduated cups and set reminders to offer water or electrolyte solutions every few hours to prevent dehydration. For tube feeding or supplemental nutrition, strictly follow the prescribed method, sterilize syringes and tubes, and monitor for signs of intolerance like bloating or diarrhea. Keep a daily nutrition log to track intake, especially for patients who are underweight or losing appetite. Medication management, dosing, timing, and side effect monitoring. Medication errors are a common hazard in home care, but they are preventable with strict organization. Use a 7-day pill box with multiple compartments for morning, noon, and evening doses. For complex regimens, use smartphone apps such as MediSafe or MyMeds to receive automatic reminders. Keep a medication chart with the name, dosage, frequency, and purpose of each drug. Note potential side effects and interactions, especially with over-the-counter supplements or herbal remedies. Store medications in a cool, dry place and ensure that expired drugs are properly disposed of through pharmacy take-back programs. For injectable medications like insulin or anticoagulants, learn proper techniques for drawing, injecting, and rotating sites, and never reuse syringes. Mobility and positioning. Avoiding injuries for both patient and caregiver. Helping a loved one move without causing injury to either party is a core nursing skill. Always bend at the knees and use your legs, not your back, when lifting. Consider using transfer aids like slide sheets, gait belts, or mechanical lifts. Install grab bars in bathrooms, stair rails, and non-slip mats in areas where slips are likely. For those using walkers or wheelchairs, ensure proper fit and practice transferring between surfaces safely. For bedridden individuals, gently assist with range of motion exercises to prevent muscle atrophy and joint stiffness. Elevate limbs with pillows to reduce swelling, and always check for signs of deep vein thrombosis (DVT), such as warmth or redness in the legs. Emotional and mental health support. Compassionate communication. Physical care is only half the job. Patients, especially the elderly or chronically ill, may suffer from anxiety, depression, or cognitive decline. Engage them in meaningful conversations, validate their emotions, and maintain routines to offer stability. Use visual cues, memory aids, and orientation boards to help patients with dementia. Incorporate music therapy, tactile stimulation, like warm compresses or soft blankets, and spiritual or faith-based support when applicable. Even a 5-minute hand massage can reduce anxiety and foster connection. Never dismiss concerns as trivial. Emotional validation is critical in caregiving. Medical equipment know-how. Learn your tools. If your home care setup involves medical equipment like oxygen tanks, CPAP machines, catheterization kits, feeding pumps, or wound vacs, make it a priority to receive hands-on training from a healthcare professional. Watch manufacturer videos and keep manuals accessible. Clean equipment according to guidelines to prevent infection. Test battery backups or generator power sources if electricity is critical to operation. For catheters and ostomy bags, follow sterile technique during changes and monitor for signs of infection. Always have spare parts or emergency supplies on hand. Home safety protocols. Creating a hazard-free zone. A safe home environment is essential for both patient and caregiver. Remove clutter, secure electrical cords, and install motion sensor lights for nighttime visibility. Adjust furniture layouts to allow wheelchair or walker access. Use door alarms or bed sensors for patients at risk of wandering, especially those with Alzheimer's or dementia. Fireproofing is essential for oxygen users, no open flames or smoking nearby. Post emergency contact numbers, allergy lists, and CPR steps prominently. Keep a fully stocked first aid kit in the main care area. Documentation and record keeping. Stay legally and medically prepared. Keeping accurate records isn't just helpful, it's vital. Maintain a daily log of vitals, temperature, pulse, blood pressure, oxygen saturation, medication administration, food intake, bathroom habits, and any physical or emotional changes. This documentation can help identify patterns, prevent complications, and provide critical information during doctor visits or emergencies. Consider using digital health apps to back up data and share with physicians. Always carry an updated medication and diagnosis list to appointments. Leveraging technology. Smart devices and apps that make a difference. Smart home devices can ease the burden of caregiving. Use smart speakers for medication and hydration reminders. Health monitoring wearables can track vitals in real time and alert you to abnormalities. Camera monitors provide peace of mind when you're in another room, and GPS trackers are invaluable for patients who wander. Apps like CareZone, Lots of Helping Hands, and CaringBridge help coordinate care with other family members and keep everyone informed without overwhelming the primary caregiver. Caregiver support, preventing burnout and fatigue. Home nursing is emotionally taxing, and caregiver burnout is a real danger. Schedule regular breaks, even short ones, to rest and recharge. Join local or online support groups for caregivers to share experiences and seek advice. Don't hesitate to ask for help. Use respite care services, enlist family members, or hire part-time help for tasks like bathing, housekeeping, or transportation. Practice self-care with routines like walking, journaling, or mindfulness exercises. Remember, a burnt-out caregiver cannot provide quality care. If you like this video and would like to see more like it, please give it the thumbs up. Leave a comment and click the button to subscribe.